the Lunch and Learn of the 2022 and 2023 season. My name is Michael Bailey, and I have the pleasure and privilege of serving as the Deputy Director overseeing operations and homelessness here at the Seattle Human Services Department. I'm truly excited to introduce this Lunch and Learn and look forward to the other events we plan to host throughout the year. For those of you joining us for the first time, these amazing Lunch and Learn sessions allow us to capitalize on three opportunities. One, to highlight issues important to the people that we serve. Two, to provide valuable information to each of you that will hopefully benefit you, your friends, your family, and your community. And three, to showcase the incredible work being done by the HSD team members and also our amazing community partners. If you work at HSD, I hope that you noticed my offer in the scheduler. The division with the best percentage of attendance at today's event will receive donuts. And in fact, Mary Mitchell and the ADS team won the last attendance challenge. So I'll be connecting with Mary and also our new Deputy Director, Annie, to distribute donuts to both the S&T staff as well as those in the Renton office. Hoping to do that next week, so looking forward to collaborating with a few of you there. Manuel from our Legislative and External Affairs team will determine the winning division for today's event. As such, he's agreed to notify me of the winner. I'll then communicate that to the larger audience, either via email or via Teams. We'll then collaborate with the winning division's director on the delivery date, the time, and the place. I also recognize that we have more than just HSD staff present today. For those of you who work in other city departments, I just want to express my gratitude for your interest and your support in advancing the One Seattle mission by making Seattle a great place to grow up and grow onward. All right, so let's get things rolling. I'd like to kick things off by introducing Dinah Stevens, our age-friendly program manager here at HSD. For those of you who haven't had the pleasure of meeting Dinah, here's a few fun facts. Dinah is a lover of nachos, so much in fact that she named her beloved 14-year-old dog after this cheese-covered snack, so her dog's name is Nacho. Another fun fact, during the pandemic, she dedicated her time to advancing her skill set and her ability to serve individuals by completing a graduate degree online. And in fact, she did this by working in a US time zone while attending a school that was operating in a London-based time zone. So just, a true public servant through and through, and I want to recognize and acknowledge that as well. For those of you who love to travel, Dinah once took a 6 a.m. flight home to honor her civic duty of voting. She shortly flew back and went straight into work. And lastly, Dinah joins us from Los Angeles. She joined the One Seattle and Team HSD last December after spending the previous 14 years in California. As such, we're extremely excited to have Dinah here on the team. I'll allow her an opportunity to introduce her amazing team members further, and together, her team will share their insights on age-friendly communities and let you know how you can participate in the development of age-friendly Seattle's next 5-year plan. Dinah, the floor is yours.
Great. Thanks so much, Michael, for that introduction. And I also want to take a moment and introduce my co-presenters who are on the age-friendly team today as well with me. So we've got Meg Wolf, who is joining us. She's been with the city about 1.5 years, coming from higher education. Fun fact about Meg is that she loves to garden, and she also loves to eat things from her garden. And I can testify to the fact that they're delicious. I've been the beneficiary of some plum jam. And we also have Eldad Makiria with us, who has been with the city for 5 years, although she's usually with the Seattle Public Library, and we've snagged her for an out of class for the last 6 months. Eldad claims that she is almost a doctor because she has watched all 19 episodes of Grey's Anatomy. So I'm not sure that I want her. I will take medical advice from her, but good to have a backup. So thanks everybody for joining us today. As Michael mentioned, I'm Dinah Stevens and I'm fairly new to the city as well. I've been here about 10 months now and I'm really enjoying it. I'm coming to this work with a background in health policy and not as much in aging issues. And so it's been a really wonderful opportunity for me to learn, and I'm still learning. And today is going to be all about learning, hopefully for you as well as for us. So with that, we'll get, oops, if I can figure out how to move this forward. There we go. So we thought about what we wanted to get out of today, and we kind of came up with 4 goals. So we would like to use this as an opportunity to further our collective understanding about aging issues, particularly in Seattle. We want to help demystify age-friendly Seattle. So I've been asked, what do you do? What is age-friendly Seattle? So hopefully we will answer that by the end of this hour. We hope that we can spark some ideas for how to work together with other departments or within our own department in new ways. And we also want to get your input on some of our plans for the future. Before we do that, we're going to throw a lot of facts and stats and figures and plans at you, but I do think it's worth taking a moment here to just recognize that aging is deeply personal. And if you're comfortable with it, I invite you to type your name in the chat if you have a personal connection to aging. And this might be you've helped an older relative navigate the healthcare system or housing or transportation, or maybe you've been a caregiver to yourself or to an older person. Or maybe you've made life adjustments to accommodate an aging person in your life. Or maybe you've just thought about your own retirement. So maybe the activities you're going to do, the financial resources that you'll need. So add your name if any of those things apply to you. And I'm seeing lots of names in the chat. So I think it's probably safe to say that almost all of us are touched by aging issues, even if we are not an older adult ourselves yet, and we will get there should we be so lucky. But really seen through this wide lens, I think it's helpful to put aging issues in perspective. We're not just talking about a very specific portion of our population, we're talking about all of us as a whole and how we're touched by aging issues, even though our focus is on older adults. So with that in mind, we are going to share some facts and stats with you. So I'm going to hand it over to Eldad to help provide a little context for us around the aging population before we dig in.
Thank you, Dinah. So let's talk about some figures around aging. We think it's really important to highlight that we are aging globally and here in Seattle locally. So we have a couple of facts to share with you all to test your knowledge and learn together. So please feel free to put your guesses in the chat, and I'll give you 10-15 seconds to put your answers in the chat. So we're going to start globally and kind of just zoom in into local Seattle. So first question is, by 2050, what percentage of the world population will be 65? Go ahead and put your answers in the chat. Okay. Those are high numbers. Okay, and the answer is 16%. 16% of people will be over 65, and consider this more than double the portion it was in 2019. So we'll eventually get to that 30%, 40% that you guys are guessing in the chat. Then we're kind of going to zoom in to North America. So in North America, what percentage of people will be over 65 by the year of 2050? Go ahead and put your answers in the chat. Okay.
Whoops.
67%. Okay, Leslie. Okay, so the answer is 25% of people will be over 65 and over by 2050 in North America and also in Europe as well. Third question, what year are older adults projected to outnumber children in the US? What year? Okay, Mignon. Close. Okay. Yeah, so we're at the tipping point. Based on current projection, older adults will eventually outnumber children in the US for the first time ever in 2035. So in about 13 years, there will be more older adults in the US than children. Then we're going to zoom in more and we're going to look at Seattle. So what percentage of Seattle residents are age 65 and plus? Good guesses in there. Yes, so 12.5% of Seattle residents are 65 and over, which is up by 2% from 2010. This percentage is growing despite the influx of younger workers in the last decade entering Seattle. So it might seem like a small number, but it's actually a very large number. Last question. The portion of older adults in Puget Sound region is expected to grow by what percent between 2020 and 2050? Last question. Okay, we're seeing lower numbers now. So the answer is actually 85%, so almost doubling. And the older adults of tomorrow are increasingly racially diverse. So it's important to consider how racial justice can compound over a lifetime and what the needs of these older adults might be as we're thinking about services that we provide. And now I'll pass it on to Meg.
Thank you, Eldad. Next slide, please. One more chance to throw something into the chat and contribute. So I would like you to share what words or feelings come to mind when you see this image here, or think of the phrase silver tsunami. So go ahead and share in the chat, please. People are thinking. Anyone have anything to share? What word comes to mind or feelings? Yes, lots of them. A lot of them all at one time. Yeah. Oh, yeah, the kids are going to get clobbered. Good. Yes, the kind of us and them. Thank you. Keep those coming, and definitely it implies there's only one thing to do, and it's run, right? So this negative stigma around aging is pervasive in our culture, and part of what Age Friendly Seattle aims to do is to challenge this stigma, and you'll see this reflected in our plans because, and moving to the next slide, because framing really matters. Our own mindset surrounding aging really does matter. Research shows that positive mindsets around aging can actually help us shift our attitude and lead to a longer, more productive lives. So reducing stigma around aging may also make it easier for younger people to plan ahead for their older years, and also for our policies to reflect the realities of an aging population, especially, as Eldad mentioned, diversifying population. So there are things that we can do as a city to encourage positive attitudes, and this is not a messaging training today, but a few quick tips, and these come from Reframing Aging and AARP research, that the best way to encourage positive attitudes is to show pictures of older adults in the workplace. And these are the most likely way to improve those attitudes. Pictures of older adults in the community is second best. And so please consider this type of thing when you're creating brochures, revisiting your website content in your own departments, and when in doubt, use Age-Friendly Seattle as a resource. So back to Dinah.
Thanks, Meg. So with all of that kind of context setting in mind, I'm going to turn back to age-friendly communities specifically. Age-friendly communities, this is not something that's unique to Seattle. So this is a global effort that the WHO is advocating. Given the fact that around the world we are aging, the WHO has asked communities to adopt a commitment to making their cities, states, neighborhoods more age-friendly. And the WHO actually sets out 8 domains of livability on which to focus, and we'll talk about those in just a moment. Here in the US, AARP is leading the efforts. So AARP is the entity that gives us the designation as an age-friendly community. It does not mean that we have met a certain standard or that we've received the stamp of approval and we are age-friendly. It means that we've made a commitment and we put that on paper and we're kind of backing that up with action. And then, of course, local entities are responsible for implementing actions. So the WHO is not going to come here and make our city friendlier for older adults. We have to do that ourselves. So that is what Age-Friendly Seattle is. It's sort of the implementing arm in this context. It has been around for about over 5 years. And so just a little bit of history here, and some of you likely know more than I do about this. From the 70s until 2017, there was actually a mayor's office on senior citizens, the MOSC, I think it was called. And this was really service oriented. But as community-based organizations grew in their ability to provide services, it made sense for the city to switch into more of a model of supported services rather than providing direct services. And so there was an advocacy coalition formed that was comprised of community members as well as city staff to really advance the concept of becoming an age-friendly community. In 2017, the city passed a resolution designating the city of Seattle as an age-friendly city, and an age-friendly action plan was born. And so that plan covered 2017 to 2021. So we are just wrapping that up and looking forward from here. So Age-Friendly Seattle, again, it's a citywide initiative, but we are housed within HSD, and specifically within that, we are housed within the Aging and Disability Services Planning Unit. And thanks, Leslie, for spelling out WHO, World Health Organization. So I'm not the best slide advancer, as it turns out. So what is age-friendly? What is this citywide initiative? I have done some thinking in the last 10 months since I have been here around what our role is. And I come from the world of advocacy, and so I'm sure that influences my the way I approach things, but I think that Age-Friendly Seattle can function as sort of like a mini advocacy shop within the city. And it's really our job to keep elevating the needs and priorities of older adults, both internally at the city, as well as externally in the community. So I think we can play a few different roles. And speaking of the WHO, the World Health Organization, I sort of think of age-friendly as a similar entity on a much more tiny scale, but we really can play the role of kind of a convener, an information sharer. So I'm going to talk us through each of these roles and provide just an example from the last year of our work to put this in context. So we can play the role of connectors. So for instance, we recently connected some folks at the Waterfront Development Organization who are redoing the waterfront area, both physically as well as programmatically, with some folks who are community members who are experts in accessible design. And so that the waterfront folks can learn from these accessible design experts how to create an environment that's really age-friendly. Next week, we are holding an age-friendly housing forum. You are all welcome to attend. And we are exercising our role as convener in this capacity. And so we are convening folks from government entities, from the city, from the county, as well as community organizations and other stakeholders, builders, developers, to talk about what does age-friendly housing look like for older adults? What are their needs? What are their challenges? And we can use our role as convener to do that. We have this, like, called it learner sharer. There's probably a better phrase we could use here, but really I think it's our job to learn about the challenges and the needs of older adults and then share that information with people who can incorporate it into their work. So for instance, Meg recently compiled some data around where older adults live and where their homes are concentrated, and shared that with our colleagues in the Department of Neighborhoods so that they could use that to inform their potential snow shoveling program, because we know that older adults, that might be a challenge for them and they have unique mobility needs. Again, we play this role of advocate. So we're in several spaces on boards and commissions where we're able to give voice to some of the issues that older adults are facing. So for instance, early this year, we added some comments related to the age friendliness of the Puget Sound Regional Council's transportation plan. So highlighting what will hurt and harm older adults in that transportation plan. And then we can be enablers. So there's a lot of really great work happening around the city. It's really fun to connect with new colleagues and learn about work happening. And we can be supportive of that. So for instance, on Friday, is that tomorrow, we are helping the Parks and Recreation team to relaunch their Sound Steps walking program, which is an older adults walking program that was active pre-COVID, and we're helping to bring it back to folks. So it's not our program that we're running, but we are supportive of other teams. And then we can be doers as well. So we do have a couple of our own programs that we manage. And so I'm going to actually hand it back to my colleagues to talk you through two in particular. So Meg will share some information about the Gold Card discount program. But first I'll hand it to Eldad to talk about the monthly Civic Coffee events that Age Friendly Seattle hosts.
Yes, so Civic Coffee is a monthly event we host in partnership with Seattle Public Library. We host discussions that bring people closer to their government officials, community leaders, and their community. Over the years, Civic Coffee has really evolved. During the pandemic, we had them virtually, and it was really successful because people needed a virtual space to connect. So between 2020 and 2021, we hosted 55 virtual events with about 11,000 views. But now people are really eager to go back out and participate in these like in-person programs. So we're kind of exploring, in order to meet those needs, we're exploring hybrid events. This is where we take the virtual events to a community. So this past week, we hosted it at High Point Neighborhood House, where we provided language access in 3 different languages and streamed in the panel discussion. And these topics they vary in topics. So we had like finance and aging, creative aging, Parks and Recs month. This past one was, we celebrated World Food Day to kind of raise awareness about hunger and food insecurity in older adults in our community. So if you work with older adults and hear the same themes come up over and over again, and think that it's important to discuss, I invite you to share it with us. We're always looking for topics to discuss with our older adults and service providers that work with older adults. And these are some of our flyers. I'll pass it on to Meg to talk about gold cards and flashcards.
Thank you, Eldad. So what are gold and flashcards? I know many of you know, some of you may even have one, and perhaps for a few of you, this is new. And so going to the next slide, the eligibility for gold and flashcards, for gold, it's 60 plus, and for flashcards, it's ages 18 through 59 with a documented disability. There is a related online directory with attractions, services, retail businesses, even programs to save money listed there. We have age friendly throughout this year, almost doubled the number of entries in the directory since 2021. And it's a place where this online directory is where you can search a business by name or zip code or category. There's category listings from retail, shopping, food and beverage, restaurant, fitness and recreation, health and medical. So there's ways for people to know what they're looking for and target when they're in the directory. Age-friendly discount program also helps support social interaction. We feel it's really important to allow older adults and people with disabilities to go out into the community and do so together. Affordability is also really important in an expensive city and area. Anything helps to provide economic relief. And definitely increasing awareness helps to raise the profile and the needs of older adults in our community, and helps make us a more age-friendly city. So the types of discount, moving on to the next slide, there's attractions on there, and highlighted here is the fabulous aquarium, who is our flagship partner. There's significant savings if you have a gold or a flash card at 100% off of admission. The image shows that it's a great place for people of all ages to visit, and they definitely show their commitment by offering such a great discount. And certainly we invite you to visit any of the businesses listed here. There's tons more. This is a whole range of newly added businesses, from home goods to car repair, garden shops, to training simulation for driving, and toys and puzzle shops. Lots of great things. So on the next slide, you might be thinking how to connect with this work. So certainly, and many of you on the call, I know I've talked with you about this, and many of you even have requested bulk gold or flashcards for your own clients, which is so great. So thank you for that. Shout out to everyone who's already done that. But this is a chance for you to add value for your clients in their lives. So let me know, and I will definitely get those sent out to you. And then, or feel free to just send individuals to the new online application for the gold flashcards too. It's easily linked off of the age-friendly website. You can also recommend any programs. If you know of any free or reduced cost programs for older adults or people with disabilities, send the details our way and we'll get that into the directory. And finally, help solicit businesses. Tell your favorite local businesses or restaurants about the directory. Sign up is easy, and we have a new streamlined online form for businesses as well. So the next slide, as I mentioned earlier when I spoke about stigma reduction, we are creating an anti-ageist training for city employees, and all our work at the city in all our departments at some point touches the lives of older adults. So we want a training to demonstrate that, and demonstrate this is a collective effort. And so we are building that now, and we would love for you to be involved, and there will be more to come. So with that, I pass it back to Dinah.
Great, thank you. So I'm not going to spend too much time talking about the last 5 years, because many of you might have been on the recent Human Services Department all staff, where I did share a few highlights, but I also know some of you were not there. So just a very top level summary of the work that was accomplished in the past 5 years in that first action plan. These are the 8 domains of livability that the WHO has invited communities to consider making improvements in. And so, as you can see here, transportation and housing, we had a lot of actions planned in those areas. Part of that was because in our initial needs assessment, those were the areas that older adults really told us that they wanted support in, and to see some changes in. So we made progress on a lot of those actions and towards a lot of those goals. But then the pandemic happened, and all of a sudden, social connectivity and access to information became super critical. So we were able to pivot and focus on that instead. And so you'll see, I think the team, and by the way, I get no credit for any of this. This all happened well before my time. And a couple of folks on this call probably were very engaged with this work. So kudos to everyone. So of the pretty broad range of actions, there was 87 listed in the original action plan, and the team made progress on 68 of them. So I think that's pretty remarkable given the fact that there was a pandemic in the middle. So kudos to everyone who helped make that happen. And I'll also invite folks to check out our full report online. So there's a long report, maybe 47 pages where there's lots of detail, but there's also an executive summary where you can kind of catch the top lines. And that's on our website, our age-friendly website. So what's next for age-friendly Seattle? I have the lucky job of coming in kind of at a great pivot point where we're wrapping up one plan and starting another. And so I've done a lot of thinking about what do we want to accomplish and how will we do that? And how will we know if we're making an impact? So the next few slides, I'm just going to share my thinking with all of you and just give you a little window into how we're approaching this work and how we're framing this work before we get into any of the details of it. So we've had this tagline for a long time, which I love, and I think it works great as a mission statement, which is age-friendly Seattle aims to make Seattle a great place to grow up and grow old. And this is great because it sort of spans the lifespan, right? And age-friendly is all of us. We're all aging. These are some guiding values that we've put together, and I am not going to spend too much time reading these right now, although I'm happy to share this with folks if you're interested. They largely echo HSD's values and principles, but I found it helpful to articulate them for age-friendly Seattle just to reaffirm our commitment in some spaces and really be able to use these as a touch point to come back to if we're feeling like we're having trouble prioritizing which actions to pursue. I think these are helpful to guide us. So a couple highlights here. We really want to lead with race, and this is something that HSD is doing. I know Seattle on the whole has made a real commitment to do, and I really feels good to work for a place that is making this commitment to equity. And as Megan Eldad shared, our population of older adults is becoming increasingly diverse, and so it's really important for us to be thinking about racial equities in this space. We really want to recognize the intersectional nature of these issues and how one thing can impact another. And we really want to do this work in partnership, both with our colleagues around the city, so thank you for being on this call, as well as partners in the community. And I'm happy to make this available to anybody who is curious. So as Michael mentioned, I ended up doing my master's online during the pandemic. So I am maybe particularly kind of like primed, and I come from the world of nonprofits where everyone has a theory of change. But I really did want to spend some time thinking about what is our theory of change? Like, what are we trying to do? How are we going to do it? And how are we going to know it works? So we talk a lot about thriving, helping older adults thrive. I think that's a common language in human services spaces across the board. But I started thinking, like, what does that even mean? What is thriving? How do you know if someone's thriving? It can mean a lot of different things to a lot of different people outside of a clinical context. So I did a little thinking about what would be a good proxy for thriving that is measurable. And life satisfaction of older adults is very much studied and very much measured. And so I like using life satisfaction as kind of a proxy for thriving. So perhaps then our mission is to ensure that older adults have a high life satisfaction. And then the question became, well, what drives high life satisfaction? And if any of you are scholars of the theory of continuity, you'll probably know that I'm sort of butchering this, but my interpretation of some of the research that's out there is that continuity is really important to life satisfaction. Aging comes with some inevitable changes. Bodies may not work the way that they used to work. There may be loss of friends, loss of a spouse. There's an adjustment from a work life to retirement. But the more people are able to retain continuity in other places of their lives, the better they are able to cope and adjust with some of those aging changes. And that really does help improve life satisfaction. There's research actually showing that people who are unable to maintain continuity actually were more likely to die. So this has a pretty profound impact on folks. So then the question became, well, how do you help someone maintain continuity? And continuity can be of their home. Is it the place that they love to live in, the neighborhood that they're familiar with, the home they've lived in for decades? Continuity meaning hobbies that they love to do, healthy enough to continue walking, doing the things that they might love, stay close to friends. And it turns out that there's some indication that there's 3 resources that folks need in order to maintain continuity. Number 1 is physical, so this is health. Number 2 is financial resources. It's hard to maintain continuity if you don't have the resources to keep your home, for instance. And then the 3rd is social resources, and this is more of an emerging conversation. It's actually what I did my master's thesis on. But social continuity is a high driver of and social engagement of life satisfaction in older adults. So all that to summarize, our theory of change is essentially, if we can help older adults maintain these 3 key resources, that will support their continuity and therefore increase their life satisfaction. And so our entire kind of action plan looking forward really is geared towards thinking about what can we do to help people hang on to physical, financial, and social resources. So this is what that looks like sort of visually. And again, I think there's awareness that this work is really intersectional. So I want to pepper in a couple local considerations here. So when it comes to economic security of older adults in Seattle, what people have voiced is that this is largely, housing is a huge concern to folks. Transportation is also a high priority item. And this makes sense, right? We have an influx of high income earners and a limited supply of housing, and older adults are on fixed incomes, and that is just really hard to compete to get housing in Seattle. And so that's a big priority for older adults. Other things impacting older adults' economic security are things like financial fraud and abuse, which is certainly on the rise, access to affordable transportation. A lot of folks don't drive once they're older, and so transportation options become increasingly important. Health and well-being. So when we did the original assessment in 2017, this is actually something that older adults in Seattle ranked as being pretty high. So in terms of their satisfaction with it. So people felt like Seattle had good healthcare access. And I think in particular, people really loved and appreciate the parks that Seattle has. And so that's all good information for us to know as we're thinking about how can we support the health and well-being of older adults here. And then finally, this bucket of social connectivity. And then, there's increasing awareness that this is so important and so connected to people's health and such a big driver. And it's not, isolation is not merely an outcome of poor health, but that isolation actually can cause poor health. And of course, in each of these 3 areas, it's really important to think about the target audience. And so Age-Friendly Seattle, it's a little tricky because our target audience is wide, right? And so we might be talking about very low income adults who live here, as well as middle and higher income adults who live here. So, sorry, I'm distracted by the chat. So we have a lot of different factors to consider. So we wanted to pause here and see if we could break into groups. I think we're going to call this like a lightning round breakout session. And maybe we can just spend 7 minutes, let's say, in our breakout groups. And what I would love for us to do, for all of you to do, is to, in your breakout groups, kind of talk about the ways that your own work intersects with these 3 buckets when it comes to older adults. So do you work on housing issues, or are you a case manager, and are these the issues that people keep bringing up to you and are needs that people are expressing? So we'll give everyone maybe 5 to 7 minutes to kind of get a little brainstorming done, and then we'll come back together after that. So I think I have an instructions page. Oops.